The past few years have brought a culture shift around talking about mental health in the workplace, but many organizations still find handling mental health concerns tricky. We're here to help you navigate these waters. Today, we're sharing what to do, what not to do, and what to plan for when it comes to mental health in the workplace. Hi, I'm Kristen with Unexpected Virtual Tours and Training. We host radically creative DEI and team building events for remote and hybrid teams. Today, we're going to talk about mental health awareness, do's and don'ts in the workplace. While increased attention and decreased stigma around this issue are positive steps, we know that mental health awareness is a sensitive topic. It's important for your team to be proactive about fostering a healthy work environment, so here are some do's and don'ts to guide you in your work. Some may ask, why? Isn't mental health a personal issue for employees to deal with on their own time? However, mental health and workplace experts agree addressing mental health in some form is important for a safe and productive workspace. But while some people are well versed in talking about mental health and we all care about our coworkers' well-being, most of us aren't trained mental health professionals. So we turned to some guidance from the pros. Here are some expert-vetted suggestions to make sure mental health awareness at work is handled in a safe and constructive way. Here's a do to start with. First of all, do be proactive in learning about how mental health affects employees and developing a plan for your workplace, especially if you're in a leadership role. How should managers and colleagues respond when employees show signs of stress or mental health struggles? How can you address issues in ways that are supportive rather than punishing? Can you and your team identify signs of mental health struggles, which can include, but certainly are not limited to, stress, anxiety, and depression? Developing an official plan your whole team knows, along with a strong list of mental health resources, will be helpful tools. And that brings us to our first don't. Don't make assumptions or jump to conclusions about a coworker based on behaviors. Issues like lateness, missed meetings, increased errors in work, frequent breaks, or using up sick days can be frustrating, but oftentimes these behaviors are signs an employee is struggling, and not that they don't care about work. But you also don't want to rush to assume someone is experiencing a mental health issue. Perhaps it's just a temporary stress, or a lack of clarity or resources for their role. Take the issue seriously, but try to approach conversations with colleagues without judgment or assumption. That brings us back to a do. If you notice a colleague struggling, do invite them into a conversation. And do take any mentions of self-harm extremely seriously. Approach this conversation not with judgments or guesses about what's causing this behavior, but about what you've noticed. And do be mindful that many employees might not want to disclose mental health struggles, especially to supervisors. However, if a mental health issue is at play, recommend the best resources according to your team's plan. And if it's not, at least you've taken a step forward in collaborating on a solution, and that's a win-win. Here's another do. Do use a helpful and sympathetic tone when communicating with someone about their mental health, even if it is affecting productivity. Do this in a private and respectful way, avoiding putting employees on the spot or pressuring them to disclose personal information. At the same time, however, avoid taking on any therapist-like role. If it's starting to feel like a serious issue, it's a good idea to stop, slow down, and recommend your team's resources. For our next don't be impatient or frustrated if intervening with the issue is unsuccessful. And don't pressure anyone into talking about one's mental health state if they're not open, even if you've already had one conversation with them. Also, avoid creating pressure or a timeline for getting better. Now for a don't make or pressure any employee to take time off for mental health issues. Sure, an employee might appreciate a little break, but some might misinterpret this as a message that they're not a valuable part of the team, or worse, that they're especially not valuable if struggling with their mental health. Instead, ask them what accommodations could help them through this challenging time, such as switching to a more remote or hybrid setup. Remember, though, that asking them about their needs is helpful, but many people will pressure themselves to try to work through their struggles. So be ready to present them with a list of options and accommodations so they don't have to make the request themselves. Also, consider what you can do to advocate for your company to have a flexible PTO policy that lets employees care for themselves. After all, mental health issues are health issues. And here's another thing that you shouldn't do. Don't give unsolicited medical advice. Leave this to the professionals. If you don't know what to say to a colleague who discloses a struggle to you, sometimes it's okay to just say something affirming like, "I am here for you if you need to talk." Regardless, don't underestimate the severity of someone's struggles, even if you have dealt with similar yourself. But especially if you haven't. Avoid sayings like, "You'll get through this," "You're strong," "This is nothing," or "You'll be your right self again in no time." These kind of comments can minimize someone's experiences and discourage them from seeking further support. For our next do encourage everyone to attend workshops, seminars, and public speaking events that address mental health in the workplace, especially if you're in a leadership role. Increase or promote access to these resources on site as much as possible. Even better, procure a list of professional resources and recommendations to have in place for your team. Make sure these are transparent and easily accessible. Oh, and on that note, if your company doesn't already have one, consider establishing an employee resource group around mental health issues or disabilities. All of these proactive steps help create a culture of transparency and support around mental health. Here's a powerful do. Do set an example of vulnerability and strength that the rest of your team can follow. This normalizes talking about mental health in the workplace and helps workers know that they matter. When and where appropriate, it may not be enough to just say your workplace supports mental health. It ought to be shown and demonstrated. And experts recommend this. It can be especially impactful if senior level employees make this a habit or a routine. And there's so much more that we could cover, but that's all for now. How would you recommend improving mental health awareness in the workplace? How have your colleagues or work created a culture of support? How has someone supported you in the past? Share with us in the comments below. We want to know. And if you haven't already, click like on this video and subscribe to our Unexpected channel. You'll receive notifications for our latest holiday and work-related team building content and keep up to date on the latest DEI tips and trends that you can also share with your team. Click that share button to do so. Until next time, stay informed, stay inspired, and stay in touch.